Hi, my name is Natasha. I'm here with Dr. Thomas at Pelvic Laser Institute. Today we're going to be talking about well woman exams. Introduce yourself, Dr. Thomas.
Hi, thank you for having me. I'm Dr. Thomas Toussaint. This is my practice here, Public Laser Institute. It's a pleasure to be with you guys. And Natasha, I know you do have some questions you would like to ask,
Of
so this
course.
is the time.
So tell us a little about what you do in a well woman exam.
The World Women exam, by definition, this is an exam women come to get checked to see
Mm-hmm.
if everything is okay. It's an annual exam, and
Mm-hmm.
to some extent, we do put a lot of emphasis into it
Mm-hmm.
because that might be the only time you might see a doctor throughout the year.
Okay.
So, to some extent, it might even replace your physical exam. And that's why we put so much attention and importance when a woman decided to come do a World Woman exam.
Awesome. So how do we prepare for it? What do we need to do?
Uh, Usually, the first thing I would say, if you want to have a well woman exam and you want everything to be done, if you're having your period, please don't come
Okay.
because we won't be able to do everything that we were supposed to do.
Mm-hmm.
This is one. So, if you already schedule a well woman exam and you do have your period on the same time, please call the office so we book you for another visit. What else? You don't have nothing else to do. You just come.
Just show up.
Just show up and we'll take care of the rest.
Awesome. That's good to hear. What screening test should I do during this visit?
Exactly. The most important part of a well woman exam is your gynecological evaluation.
Yes.
Some women will say, okay, I don't need a well woman exam because I'm not sexually active. Some women will say, I don't need a well woman exam because I'm too old.
Mm-hmm.
Neither one fit into that category. You need a well woman exam as a woman because there are so many things that can be assessed for a woman to that exam. You'll be surprised. And that's why it is categorized by ages
Yes.
from age when you just get your period, from the period you able to conceive, and afterwards
Mm-hmm.
when you get perimenopause and menopause.
Mm-hmm.
To each of those steps, women go to different changes into their life.
Yes.
And
Body
then
changes all the time.
exactly. And that's why, like we usually say, they have hormones, right?
Yes.
And then when those hormones are changing, moons are changing, and then woman needs more attention, and gynecologists can help you to see where you are,
Mm-hmm.
and we help assess that. And on top of that as well, one other thing that is more important, especially for women who are into the reproductive age, it is very important they have an exam called a pap smear.
Yes.
Pap smear where we screening you for cervical cancer, and this is very important. If you look at the United States, cervical cancer is not as prevalent as it is into the third world country. But
Mm-hmm.
inside of the United States itself, there is some disparities. For example, you'll find cervical cancer mostly into the black population. You'll find it into mostly into the Hispanic population
Mm-hmm.
because those people not prone to go to the doctor on a yearly basis to get to get checked and do a just simple screening, a swab into the
Yeah.
cervix. We send it to the lab and it come back, it tell us if you have good cell or bad cells,
Yeah.
and depends on what the result, this is when we're going to decide what is the next step is. This is very, very important because if you let it go too far, now we might have to cut, we might have to remove your uterus, you might lose your fertility.
Yeah.
It's a little bit too much. A
Yeah. So
well
we don't
woman
want that.
exam, just 15 minutes with the doctor, we assess you, you'll be on your way, and see you next year.
All right. That's awesome. Well, I'm glad you mentioned ages because some people don't know how early is too early and how late is too late. So I'm glad you mentioned that, especially for people who have painful irregular periods. Is that normal or is that something that we should be seeing a doctor for?
Definitely, you might be having cramping with your period.
Mm-hmm.
But if you have your period to the point you cannot function, this is not a good thing. A good thing. There might be a lot of other things developing down the line that might be costing you, for a young woman, for example, your fertility.
Mm-hmm.
And one of the diseases that you might be facing sometime is called endometriosis. It can affect all your pelvic floor where your tubes get destroyed and you're not able to have kids. And also there are some sequelae of infection that you might be having, and then with your period now, they became worse. So there is a disease called pelvic inflammatory disease, PID. So it is very important. If you are doing okay at the beginning of your period and you see you start having pain and the pain getting worse and worse through your period, it is very important that you come and get checked and you'll do a pelvic sonogram, we'll do a clinical exam, and on the basis of that, we can say, okay, we think this is what it is, and this is the kind of approach we are going to have in order to help you go through the situation and fix it before it gets worse.
Awesome. That's good to know. So, what are the birth control options you guys offer at the office, and how do we figure out which one's the best for the client or the
Uh,
patient?
Birth control option. When you talk about birth control, you gonna have to categorize them. There is hormonal method, there is non-hormonal method,
Mm-hmm.
and there is also what is so-called a barrier method. When you come to hormonal method, you get the pills. It's the most difficult one to be honest with you, because you almost have to take it every day, almost around the same day,
Yeah.
and if you miss 1 or 2, 3 days, it became not effective again. You can be pregnant. So the second option after pills, you get the injection. You can take every 3 months,
Mm-hmm.
and then after the injection, you can get every 3 months. You get something called the Nexplanon that you can get inserted into
Okay.
your arm for 3 years, and then when you get to the bottom, there is something called IUD. IUD called intrauterine dispositive that you can get inside the uterus. There is one for 3 years, there is one for 5 years,
Mm-hmm.
there is one for 10 years.
Yeah.
3 and 5 years, they are hormonal based. They are based on a hormone called progesterone. And then the one for 10 years, it is copper related. It is good for 10 years. The mode of action is a little bit different. The one with the hormone sometimes can make the woman feel good, feel, not really herself because of more hormone. It's changing from one woman to another. And also that one can give you more bleeding problems sometimes. But the one for 10 years, which is copper based, is mostly give you an inflammation inside the uterus and prevent the egg to be seated there and have a baby. That's all.
Okay. For a woman who has fertility issues, what are her options that you guys offer at your office?
Fertility issue depends where you at
Age-wise?
exactly.
Okay.
Because, for example, I've seen some young, I would even say couple, people living together, and they says, okay, I've been trying to be pregnant for 3 months or 6 months, and I cannot be pregnant. We cannot call that a fertility issue,
Mm-hmm.
because if you go by the definition, before you can say women have a fertility issue, they have to be living together for, depends of the age, less than 30 for at least 1 year, having unprotected sex, and they cannot be pregnant. This is now you can start investigate.
Okay.
But I will switch that question easily to tell you the best way to start an infertility workup is to start by the men,
Mm.
because it's so easy for the men to get tested with a semen analysis, because most of the time women might be thinking they are the problem, and sometimes the men can be the problem.
Mm-hmm.
And before you go do all those tests for women that cost so much money, time, anxiety, stress, you name it, it's easy to do a semen analysis for the men. As long as the semen analysis is normal, now you can start putting focus on the woman and see, what are the steps you're gonna take.
Yeah.
There are a lot of tests, a lot of things to do, but we easily can figure it out if we start by the beginning, which will be the men, obviously.
Okay, awesome. That's good to know. You guys offer all that at the office, and that's awesome.
Yes, this is a place I would say for women, and
For men too. That's good.
I would say for everybody,
Inclusive.
especially like, yeah, I would say like when you think about it in a couple wise, yes,
Yes.
we do see men, and sometimes we might send them to do tests and bring us the result and evaluate things like that. But we also focus like, in that practice, women at every ages. If you first get your period, we focus on you. If you initiate your sexual life, we focus on you because we can test you for STDs to make sure everything is okay. If you're in your reproductive age, we'll evaluate you, do prevention testing for cervical cancer. Now, when you get to perimenopause, it's a different issue. Hormone is changing. You feel hot, you feel cold, you're losing your hair, all of those things. We'll assess your hormone base and get you going. And then if you come to menopause, now you start having some other issue practically related to menopause, where you don't want to be sexually active anymore, you feel old, you don't feel yourself, which is a wrong impression that you give to yourself. Obviously, most of the women go to menopause around the age of 50, 51, the most by 53, more than 75% of women already get menopause.
Yeah.
So imagine like, the age limit now it's about 80. You still have a 30 good years of life in front of you. So if you get your hormone balance into your menopause, that's what we call hormone replacement therapy, that help you to live healthier, to live longer, to be
Enjoyable.
happy, to be enjoyable, and no stress. You're going to life like you're in your 40s,
Mhm.
late 30s. And I think that's why that office offered all those options. My goal is to be available to care for women to
Throughout
all
their
the age.
lifespan.
Exact. That's my goal.
That's awesome. So what if sex is uncomfortable or painful for the woman?
Many situations can do that. For example, like I said, if you develop infection, this is one situation that can do that. If you just have a child, this is
Mhm.
one situation that can do that. If you're going to perimenopause, this is one situation that can do that. There are some medication you're taking that can do that. And if you get to menopause itself,
Mhm.
because your hormone is not producing as much as hormone that you
Yes.
need to function, that's gonna make your sexual life definitely miserable.
Decline.
So get checked. We'll tell you exactly what the diagnosis is. There is always a way we can help you to get and feel better.
Okay. And then if a woman has, some leaking, probably from laughing or coughing, does she see an OBGYN or should she be seeing a bladder specialist?
They should be seeing a bladder specialist, which is part of my fellowship, my subspecialty here.
Mm-hmm.
Because what really happen, women have tendency to leak. Age can do that, pregnancy can do that. In the past, we used to think is when you push a baby happen, but now we do know better. It doesn't happen because you push a baby. It's happened because you are pregnant.
Mm-hmm.
Because of all the way the pregnancy put on your pelvic
Yeah.
area, it distort everything.
Mm-hmm.
The best way to fix it is to prevent it. And that's why in that practice, we are offering bladder control. So what we do after you give birth, for example, I do have a chair with electromagnetic power in it. If you sit on that chair, it can help you to control, to
Mm-hmm.
give you a lot of vibration, and that help to control, to reactivate again your pelvic floor muscle, and that help you to prevent urinary incontinence that you're gonna develop later on in life.
Mm-hmm.
So I definitely really encourage every woman who just get a child, when you go for your postpartum visit to get evaluated, the doctor can help you to pick what are the muscles you have to work on in order to help you to prevent having early urinary incontinence. That's definitely gonna mess up your sexual life.
Yeah. And is it better to do it early on or is it just as effective later on in life?
The earlier you do it, the better it is. And I will give you a little bit of statistic quick here. 60% of doctors, if you go to, they're not gonna ask you question about urinary incontinence.
Mm.
85% of women not going to volunteer they have a problem of urinary incontinence or fecal incontinence, because whenever that question asks, is shh, 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 we don't talk about it because we don't want to give part of our private life out there,
Yeah.
which is the problem. Everything starts by education, and like I said, if you just have a child, that's the time to start.
Mm.
And I know it's some European country where medicine is regulated. Before you go back to work, you have to bring a paper that shows you have your pelvic floor therapy
Oh,
rehabilitation
wow.
done.
They definitely
It's
need to do that here.
exactly that. It's all about education. Let's try to go ahead and prevent things instead of waiting for them to happen, and then now we're trying to fix them. The best medicine is prevention. The best medicine is not curing things.
All right. Speaking of prevention, breast examination, want to prevent breast cancer. How often should we be doing it and how should we be doing it?
Breast examination, breast cancer. There is a lot of things they said about, self breast exam, which is a very important thing to do. Every woman can do that. And it doesn't matter what age you want to start to do it, but there are some guidelines on how to do it. If you want to start to do your breast woman exam, your self exam, the best way to do it is when you're taking a shower, for example, or if you lay down, you can put one hand on the top of
Mm-hmm.
your head, and then with the opposite hand, with four fingers like that, you
Mm-hmm.
try to palpate your breast. You
Okay.
think like your breast being divided in four quadrants,
Gotcha.
and you don't point at it like that. You just try to put your finger and push the tissue down. And as you're pushing the tissue, this is when you can feel if there is
The
something
lump.
that is different.
Okay.
You're not gonna feel it the first time, but if this is something you're doing for yourself all the time, what will end up happening if something pop up
You'll know it's
because
not normal.
exactly.
Gotcha.
So it's by repetition that you will find what is wrong. But if this is something you do once a year, twice a year, even something is changing, you probably won't be able to see it because you are not used to do the same thing over and over. And the best time to do it, usually, it is recommended to do it twice a month after your period and before your period.
Gotcha.
So now you can have a better sense because with your period, your breast tissue get bigger. Sometimes it can be painful, and then after your period, you get relaxes a little bit, and then you can feel better.
Awesome. Well, what should a woman be doing between her visits for her gynecological health?
From one visit, if you are in a stable relationship, everything is okay between you and your partner, and you don't have any bleeding issue, you don't have any problem into your sexual life, a 1 year well woman exam is more than enough. But there are some women every now and then they have a change into either their sexual life, either sometimes the kind of products they are using. Some other women misleading themselves do what is so-called douching. All of those things can change your flora into the vagina, and then you might be having some abnormal discharge, you might be having some itching and so on. Whenever something out of the ordinary that you are not used to pop up, it is okay to come to the doctor and get checked because you don't know what trigger it, why it's happening.
Yes.
It's better to come at a quick visit. They tell you, okay, we swab or we examine, we don't find nothing, and you're on your way instead of waiting and then something that could have been prevented become worse later.
Yes, understood. Well, thank you so much for all this information. Of course, we want to know what makes your office so special.
Oh. It's the people like you who come to see me, who talk to me all the time, who's asking me questions. This is a place for everybody. Obviously, I'm trying to make it a welcoming place where people will come, feel free to ask questions to the doctor and talk to the doctor. I even get free consultation online for like 10, 15 minutes. Somebody can book and you don't have to come to the office. If you have a question that is bothering you, I try to take 1 or 2 people a day whenever I'm in the office for 5, 10 minutes. I can give you a quick free consultation because, like I said, once again, it's all about education.
Yes.
I believe the more you educate people, the more aware they are of the situation, and that prevent complications from happening. What make me special? Because I educate my people and they know what is right, what is wrong, and what to do next.
That is correct. And 4 different languages, guys. So come on down.